Hello and welcome to Good Life, the health show with me, Pooja. Well, this is a show that focuses on providing you with solutions to your health-related issues, lifestyle and much more. Well, viewers, today the topic that we will be discussing about is an issue that is faced by thousands of women. Now, having menstrual cramps is one of the most common, or maybe you can say it's one of the most annoying parts of your period. They can strike right before your period starts or during that time of the month when you are going through your menstrual cycle. For some women, the discomfort is merely annoying, but for others, menstrual cramps can be severe enough to interfere with their day-to-day activities for a few days every month. So, to discuss on this, we are being joined today by Dr. Aminakshi Dutta, gynecologist from Pratiksha Hospital. So, not to waste any more time, I'll straight away move to her and talk more on the topic which we have taken today. Well, thank you so much, Doctor, for joining to Good Life, the health show. So, Doctor, today the topic which we have taken is a talk of the town, we can say.
Right.
Now, what are the common problems related to menstruation, Doctor?
Okay, first of all, good afternoon, and thank you for having me on this show. I'm discussing with our problems related to menstruations. As you have mentioned, the most common problem is cramps, menstrual cramps, which a woman may experience right for 1 day, 2 days, or some women experience it throughout their during the whole flow. But how to handle with your cramps, whether your cramps have changed the pattern, in the sense that first used to have only on the first day, second day, now you are having even before the onset of your periods, or the intensity of the cramps have changed, or women with an active sexual life, if the pain is more during her sexual activity, then these are the times that you should be worried about. Or if the pains have increased to such intensity that you are having problems with your bowel movements, problems with your bladder movements, then these are the warning signs that you should meet your gynac and discuss your problems.
Okay, so these are some of the common problems, Doctor, right. And if any of the person or any of the women find these kind of common problems and they are not having an ease with it, so they should immediately go and see a doctor, isn't it, Doctor? Now, if we talk about the flow of the menstrual problems which everybody goes through every month. Now, if we talk about the flow, it depends on person to person, isn't it, Doctor? Right. So, what do you have to say on that?
Yeah, flow, we should not generalize that this should be the flow pattern for each woman. Some may have their periods only for 2 days, right from her onset of menarche. For that woman or that girl, that pattern is normal. Or some women may bleed, say, for 5 to 7 days also. But if that is the pattern for her right from the beginning, that's normal for her. We should be worried. Now, I'm telling you the times when we should be worried when there is a sudden change in the pattern of bleeding. Okay. Suppose you were bleeding for 5 to 7 days, then suddenly it has come down to 1 or 2 days. Right, and suppose you were bleeding always for 1 to 2 days and now your duration has increased, say, from 7 days, or we have seen women bleeding for 8 to 10 days. Then if there is a sudden change, then you should again see your gynac.
Okay, okay.
It's not necessary that there will be a problem. Sometimes it happens because as our body is not a static condition, similarly the hormones in our body which regulates the menstrual cycle are not static.
Okay.
There is always up and down.
Up and down.
Up and down, so that it reflects in the menstrual cycle. If everything is fine, if there are no changes in your weight, no changes in your dietary habits, no changes in your lifestyle, your stress levels, like suddenly there is no sudden increase in your stress, then it's okay. Because
everything depends on the lifestyle as well, Doctor.
Absolutely.
Doctor, we'll have more conversation, but we have to take a break. All right, viewers, we'll slip into a short break, but do come back soon because we have lots more on the other side. Welcome back, viewers. You're still watching Good Life, the health show with me, Pooja, and we are having a fruitful discussion with Dr. Aminakshi Dutta. Now, Doctor, coming back to you again, earlier to the break, we had an idea about the common problems of menstrual. Now, if we talk about, tell us about the menstrual cramps. Why does it occur? It happens with every woman. So, it depends on person to person as well. So, why such cramps, Doctor?
See, during the menstruation, our body increases the flow to the pelvic organs. That is a physiological thing.
Okay.
Because as we had discussed in the previous discussions, that each menstrual cycle, the body prepares the uterus to receive a baby. So that way it increases the blood flow.
Okay.
So wherever there is, you can imagine what happens when the blood flow comes at there is more blood flow, there is congestion. So that congestion leads to the basic pain. That is the basic and a very physiological change, and that is something not to be worried about. Okay, that pain is there. Mostly it is congestion, but some says it is like for unmarried girls who in future, if they undergo a vaginal delivery, there is a dilatation of the cervix, that is the passage, the birth passage. With that also periods pain come down because there is expansion of your organs, but that is not true always. It might happen. So that is also spasmodic pain and congestive pain. So this is the basic thing, and you need not be worried about the periods pain. It is very normal, as I have always told you, and it depends. Again, it's not that every woman will have. It's not that if you don't have, something is abnormal with our body. And moreover, as I have said, increased blood flow, increase in the anti-inflammatory things, the prostaglandins, all these are increased during the menstrual time in the pelvic region.
Okay.
There's a lot of blood supply, a lot of lymphatic drainage. These leads to the pain and discomfort and all the symptoms associated with menstruation.
Now, does it also depend with the number of days the person is having the pain, or depends on the extremity of the pain as well? If the person is having an abnormal kind of pain,
exactly.
So then is the right time to see a doctor, isn't it?
Exactly. So if there is a change in intensity of the pain, if the pain intensity has increased and the duration before, suppose you are having only for 1 or 2 days, but now you are seeing that you are having throughout your periods. Those are the times you really need to be worried about and see your doctor.
Okay. Now, doctor, is there a certain age, which is the age group we are talking about? Like suppose the one who has just got her periods and the ones who are already having periods for a long years. So if we talk about the age group, which we see nowadays, and does it happen with everybody, or is it something related with the age group as well?
Some girls, they experience, this is scientifically called dysmenorrhea.
Dysmenorrhea.
Yeah, right from the age of menarche. That means the first periods. Till her reproductive age or till the last. As I told you, some says that if you undergo vaginal delivery, there is a relief of menstrual pain because the cervix dilates. But with the increase in the cesarean sections and all, so we are seeing that this hasn't worked out much. So some women may experience right from the first day to the last. Some may experience again in their active lives of their 20s, 30s, or some may experience towards the end of their this menstrual life. It's not fixed. Nothing is fixed.
Okay. So nothing is fixed. So is there any risk also, doctor, if the person is having extreme pain?
Yeah, there's associated maybe with some pathology, like most commonly endometriosis.
Okay.
Endometriosis, or commonly people call it chocolate cyst. That means as the bleeding occurs inside, sometimes there is bleeding inside the ovaries. It's a very, I'm saying in a very layman term, there might be bleeding inside the ovaries. It gets collected. So old blood looks like what? Chocolates. So that it got the name of chocolate cyst. So it keeps on increasing, and old blood will attract all the anti-inflammatory chemicals. It will lead to all the adhesions and increase in pain, difficulty in conception, and constant discomfort in the pelvic area. Then there is another condition which is associated with extreme levels of pain during periods. It's usually in the 30s or late 40s. It's called adenomyosis, where these these glands, which should be inside the uterine cavity, sometimes those glands grow in the muscle layer of the uterus. Then during periods they become active. So it leads to extreme pain in the pelvis. That pain is excruciating pain. That is called adenomyosis. Not very common. It is not that. It is also not very rare. So these are the usual conditions associated.
And if you talk about the symptoms, like it varies from person to person as well, but it is almost common in every woman, isn't it, doctor? Now, if we talk about the general symptoms like for a menstrual cramps or a premenstrual problems the ladies face, so what are those, doctor?
Nowadays these premenstrual symptoms more and more women are experiencing, and it varies from person to person. It might involve right from the head, anything right till the toe. Most commonly are mood changes, then your water retention leading to your bloatingness, you feel heavy, and then changes in your bowel habits, your dietary habits. Then there's all these eruptions, breakouts in your skin, there might be hair fall. That's why it varies from woman to woman, but most commonly is like you feel more of lethargy, mood changes, then pelvic discomfort. And there are ways to take care of these. If you know that you are suffering these premenstrual symptoms, you just simply take evening primrose oil supplements, and it does magic to your symptoms. But it doesn't, the effects will not come within a month or so. You have to take for 2-3 months, evening primrose oil.
So are taking these supplements safe, doctor?
Absolutely safe, absolutely. And they really improves your lifestyle, because you know, that thing will come to your mind that I'm going to get my periods, and you start fighting with your friends, with your family members, and your body is also not up to the mark. So these will really help.
Now, is it something to do with the psychological problems also, doctor, with like not all women, but like there are some section of people, like they'll have a psychological thing that, oh, my dates are nearing, oh, I have.
So there are some women, they are obsessed, because they are obsessed with that, the obsession of their premenstrual symptoms. And their mood swings are like, it's very difficult to keep up. We have seen 1 or 2, it's not very common. More so your family members will able to comment more on these symptoms, and that woman is also very much aware. It is seen more in these 30s, early 40s, these women are suffering with more of these.
Now, doctor, the treatment part, or what we can say is that if a person can have some home remedies also at home itself, and later depends on the case, if it's extreme, then one has to, of course, go and see a doctor. Now, what are the things, like what are the treatment procedure that one person can do at home itself?
To take, first and foremost, you have to understand your body. You will have to be very observant about your symptoms. As I told you, if there is change or you're not being able to bear, then you have to see your gynac. Otherwise, very simple yoga postures are there. You can look up in the net, and yoga has come up in a big way in helping in these problems. And then some of the dietary supplements, like having lots of green leafy vegetables, lots of fibers, especially during the menstrual days. Then avoiding excessive carbs, excessive sugar, and then drinking lots of water. And you know, one very home thing is that soft. Having soft is really helpful. And having again warm water bath, dark chocolates, a bit of coffee, all these really works out.
So these are some of the basic things like one can opt at home itself.
And hot water bag, of course.
Hot water bag. Now, doctor, there are a lot of like awareness campaigns nowadays conducted in every schools as well to have a proper idea about the menstrual hygiene, which is very important. So how hospitals or how you guys plan up to aware people, aware the school students, and as well as the teachers as well, to guide them like how to look up to their, or how to take care of their menstrual hygiene?
Absolutely. Menstrual hygiene, as we've said, 28th May is celebrated International Menstrual Hygiene Day. Menstrual hygiene is not only taking care of oneself during the days of menstruation, but also taking care of your environment in the way how we dispose the sanitary products.
That is very important.
That is very, very important. So we need to create awareness of women about how to take care of themselves during periods, so that they don't miss out on schools, they don't miss out on work, it doesn't affect the economy. And also to tell you what products most suitable and how to dispose them without affecting our environment, not increasing the sanitary load on the earth.
And also it includes the change and the timing of your pads as well, like which is the right time, like how long you should apply the pad and how long you should change your pad frequently in a day.
Ideally, see, the changing of pad depends on the flow. If as and when required, but even if during the less flow days, ideally you should change your pad 3 times a day. It's not that there is no bleeding and you stay with that pad the whole day. No, you have to change it 3 times a day. Wash your genital parts with a gentle detergent which are available with chemical consistency which does not change the pH, and we should not do douching. That means putting detergents inside the vaginal cavity. That changes the pH, and that leads to infections which will go up to the uterus, to the tubes, and it spreads. And then abluting, like after passing your stool, it's a common practice to wash from back to front, which is a wrong practice. Actually, it's a wrong practice, because from back you are getting all the organisms, you are bringing it to the front. So the movement should be from front to back. These are very, very small things.
Very small things, basic things, very important things.
Right. And then to keep it dry, apply some dusting antifungal powders, and wear loose cotton clothes, drink lots of water, go to the toilet. That's it.
And what suggestions you would like to give? Like suppose the person or the girl is having periods and she has to go to for school, or the one who comes for work. So what are the basic things that one person can take care if he or she, I mean, like if she has to like take care of her things like to carry the menstrual hygiene products, and also if they have to use the public toilets, what are the things they can do it?
See, they can carry a bag that they say it should be a covered bag. You should not carry the sanitary napkin among all the other things, because then it will catch on dust. So you have a small pouch separately, maybe with some wipes, sanitary napkins, or small towel, cotton towel will also do. But it is the duty of the society, of us, to provide them with running water, with a toilet which has a door which can be latched with soap. So that is on the duty of the providers.
And why do only we talk about women? Like men also play an important role.
Absolutely.
Because if we talk about home, or a father or a husband or anyone at home being there, so they play an important role, like during these days, like you go through a lot of mood swings as well. So those mood swings have to be tackled by these men at
Absolutely.
place. So what suggestions do you give when they visit your hospitals, or for some other reasons as well? So of course you also counsel them for these things as well.
You say don't argue with your partner during these days. Just say yes. It's actually, it's
especially
a very
the young
personal,
girls, especially the young girls, like who have a lot of questions in their mind, like when they have their first periods, or maybe it's a lot of questions of what they are going through. So at that point in time, it's not only the mothers or the female section at home, but there should be the male section also, who should have a proper knowledge and give them a proper knowledge about it.
Actually, I think these chapters are already included in the school curriculum of them, like reproductive organs, how they function. But I think we should discuss openly in the family. There shouldn't be a taboo around the menstruation, that it is something to be hidden, something like, oh, it's to be kept a secret. No, everybody should be made part. Then only the girl or woman
depending on the comfort zone as well.
Exactly, maybe. Like even in the office, everybody should be cooperative. But it's not that you go and see, you cannot, what you say, you cannot discriminate anybody on the basis of menstruation, as it happens in our society. That's again, it's a violation of human rights. So the whole society, the teachers, the employers, the factory owners, everybody has to be involved and have to give that space to the woman. And mainly they have to provide with a basic facility of running water, soap, and a latch door, and a covered dustbin. These 4 things are the basic needs of each woman and girl.
Now, doctor, any kind of any common problem of menstruation. So if the person comes to your hospital, so what is the diagnosis part, doctor? Treatment part, of course, but first of all, one has to get proper diagnosis as well. So what is the first thing? Technologies have advanced nowadays. So what is the first thing?
Examination, proper physical examination, like blood pressure, check the blood pressure, pulse, check her abdomen if there is any obvious lump or any abnormality. Then do a basic ultrasound, hemoglobin, thyroid, all these are the basic tests. Check the weight. These are the, and above all, reassurance for the mother, for the sister. Reassurance has a big role.
Now if we talk about the dietary part, doctor, that is very important. You already mentioned that we should include leafy vegetables and also fibers included in our food as well. Now talking about the exercises as well, the lifestyle changing modalities also. So what would you want to tell? What stress
I would say that include a bit of physical activity in your lifestyle, not during the periods. It's during the dry days, because during the periods day, don't exert yourself. This will increase your symptoms. But the other days, a bit of walking, maybe at least half an hour, or exercise, or yoga, or a bit of Zumba, whatever it is, whatever suits you best, include it. And don't sit for too long. Okay. First, sitting for 1 hour, then.
So you suggest to have a walk?
Walk around, yeah, or move your legs or whatever it is. So nowadays there are lots of apps which count your steps and all. You can use them. They are very helpful. Because if you sit for too long, I think they beep that you're sitting. So you can just walk around. That will improve your blood circulation and everything.
Okay. Now, any history or anything like you would like to share with us? Any patient has come to you and it was very difficult for you or to make her understand or counsel the parents or the attendants who have come with the patient, like the person is going through this kind of problem. It happens with you as well.
I'll tell you one interesting case about dysmenorrhea. One girl, like she didn't get her menarche. She was say around 14 years, she didn't get her menarche, but every month she was getting the cyclical pain, severe cyclical pain. So her parents were worried, her relatives were worried. They brought her, we did an ultrasound, a 3D ultrasound, and we found out there was a congenital anomaly in the development of the uterus. So there are one segment of women who have very small segment, but since you're asking, that's why I'm telling you, rare case where there was a developmental anomaly. That means there was no communication between the outside and the inside. Like the uterus, the cervix, the vagina should be a continuous passage. But there was a septum. That means the cervix was not formed. So she was bleeding every month. It was accumulating in the uterus, but there was no bleeding outside. No passage. So then she underwent the procedure. She was fine.
Now so she's fine?
She's fine. And then there are cases where the uterus should be one, but there are two uterus. So those women with congenital anomalies also have excessive periods pains. So these are very rare findings, not to be taken serious. I don't mean seriously. I mean like don't get panicked. Don't get panicked because these are rare findings, and we are there to find out all that.
Okay. Doctor, we are really short of time. So what message you would like to give our viewers who are watching our show?
I would like to say that don't create taboo around menstruation. Menstruation is normal. Take care of yourself very nicely, and the rest of the family, the office, the school, they should be aware of the problems related to menstruation and handle it with grace, without discrimination.
All right. Thank you so much, Doctor, for joining to Good Life, the Health Show. Thank you so much. And with this, we have come to the end of the show, viewers, and we hope that we were able to answer all your queries in the best possible way. In our next episode, we will be discussing on some other important health issues. Till then, stay healthy, stay fit, and keep watching Northeast Live. Goodbye.